97.9, 105.5, KISS FM, Portugal the Man, Feel It Still, it's Liz and Big Papa.
And it's time for the SLOCUM Dixon Medical Moments, courtesy of SLOCUM Dixon Medical Group on Burstone Road, and 798-1500-SDMG.com. Adrian, good morning. How are you?
I'm good. How are you?
Fantastic. It seems like SLOCUM is growing and expanding and just adding and adding and adding.
Yeah, we've been adding a lot of new doctors over the summer. The newest one starting on the 18th is Dr. Cherukuri, who's here with us now, who's a neurologist, which is a really much needed specialty in our area. So we're really happy to welcome him.
Oh, very cool. Dr. Cherukuri, good morning.
Good morning.
Local guy, right?
Yes, that's correct.
So you're New Hartford?
Yeah, grew up and graduated from New Hartford.
What class?
2003.
Come on! Come on! Come on! I say that because I'm like, oh my gosh, I feel like almost like a Doogie Howser kind of a thing because you got this baby face 2000 such. I'm class of 96, and he's going to tell me about my neurology stuff. He's going to tell me about my headaches. And stuff.
It's just how it works.
And be like, listen, don't do this, and we got you. You're good to go. I think it's fantastic. I think that's fantastic that you're back here. Welcome home.
Thank you.
I think it's fantastic. One of the things I know that we wanted to talk about today is strokes.
Correct.
I've always heard about it, and the only thing I really know about it is like the aftermath, but I don't really know what a stroke is and what happens during and what to look for and whatnot. Can you give us some of those details?
Sure. So stroke occurs when there's death of part of the brain, and it usually comes from a lack of oxygen. There's two types of strokes. You have the hemorrhagic stroke, which is bleeding, and you have the ischemic stroke, which is caused by a clot blocking blood flow to the brain.
Okay.
The most common one is the clot going to the brain, and that's the one that we kind of hope for as a neurologist or as a medical provider, because that's the one we could really do something about. So the symptoms you should really look for, it could vary. It could be basically any acute neurologic change, almost any symptom. Okay, but the most well-known ones are one-sided weakness, for example, slurring of your speech, facial droop, for example. But it could be something as innocuous as a slight double vision. So any sudden change in your neurologic status can indicate a stroke. That's
the only thing I have to compare to, my only frame of reference, and it's because I'm a wrestling dork, is JR from WWE. The announcer actually had a stroke, and then after his stroke, when they would go show him, part of his face is drooping at this point, still able to do his job fantastically and whatnot. Is there certain things, like, is it hereditary, like certain family, like there's family traits and whatnot? Is it hereditary with that kind of stuff? Are there things that people can do to help prevent these?
Yeah, so sometimes it is hereditary. There could be various causes. Sometimes it's a gene defect that causes your blood to clot a little more. The most well-known one is factor V Leiden. A lot of people recognize the name when I say it. Also, people can have other familial related abnormalities in the blood vessels. For example, I just had a patient recently who had abnormalities in her blood vessels themselves, and it makes her prone to stroke and other aneurysm and things like that.
How do you know it's a stroke? How, like if somebody, like, what happens, and how do you, and if you're there with someone, say heaven forbid, Liz or I are in this room, and I go down, how can you tell it's a stroke, and what should you do?
So sometimes you can't tell, but the things that that make it really obvious at times are when it's a sudden neurological change, like I said, that points to an area in the brain being the culprit. And what do you do at that point? You call 911, obviously. You get them to the hospital as soon as possible. Time is brain. The sooner you get there, the more we're able to do for you. Specifically...
Those are words to live by. Time is brain.
Exactly. And if we get you there before 4.5 hours, we can give you what's called TPA, or tissue plasminogen activator, which is the clot-busting medication. So after 4.5 hours, the research shows that you're more at risk for bleeding than you are actually getting better. So that's why 4.5 hours is really key here.
And if you want details on any of this, make sure you like the SLOCUM Dixon Facebook page. They always have different things, all kinds of information and whatnot. So just type in SLOCUM Dixon on Facebook and like their page as well. And Adrian, of course, they're adding, if you're looking for a new primary care or whatnot, SDMG.com. And if you are a nurse and you're looking for work,
yes, SDMG.com as well for that. We have a job opening still for LPNs, also for medical assistants, and a whole bunch of other positions. And we redid our website. We were just talking about that, and so we actually have an online application.
Shut up, Pro Media!
I know.
Yes, they did a great job. So you can just jump on there. You can actually fill the application out right online, send it in, and you're all set. So we'd be happy to have you.
Awesome. Very, very cool. Again, SDMG.com. SLOCUM Dixon Medical Moment. Doctor, thank you so much. Welcome home.
Thank you.
And more with the medical moment. And, of course, head up SLOCUM Dixon on Facebook.
Let's go.